Hi everyone, happy Woman Wednesday. We're going to get started in just a minute. Today we're going to be talking about how to perform a self-exam on your vagina or frontal so that you can kind of get to know what it looks like down there and make sure you know when it's time to go to the doctor, of course. I'll give everyone a couple minutes to filter in. Hello, Kalki Ajamo. Good to see you in here. It's been so long since college. I hope you've been well. But yeah, we're going to start talking in a little bit. We're going to be going over how to perform a self-exam on yourself for your vagina or front hole. And of course, we'll go over some review of last week about, just some tips and tricks for supporting your vaginal and front hole health. I hope everyone's enjoying the super nice weather after that wintry weekend that we had. It was snowing in the East Coast and super cold. What's up? What's up? Welcome everyone. We're going to get started in just a second, waiting for my co-person to join. But we will be talking about self-exams of the vagina and front hole today. Awesome. Hey Paul, how are you?
Good, how are you?
I'm good, thank you. All right, cool. So during the COVID-19 pandemic, Whitman-Walker's community health department has expanded its outreach efforts to social media. We cover various topics about HIV and STIs and sexual health practices to accessing care and social determinants of health to public health interventions. So basically everything under the health umbrella we'll cover on here. The community health team is here to support and educate you. And my name is Jewel and my pronouns are she, her, hers. Today we're going to be talking about part 3 of vaginal and front hole health and health for folks who are assigned female at birth. So we're going to talk a little bit about what we've gone over the last couple of weeks, some tips and tricks, as well as how to conduct your own kind of self-exam to see if it might be time to go to the doctor. These tools can also be super helpful for you to identify whether your partner might need to also go to the doctor or get tested or what have you. So a little bit of review from last week and the week before. We talked a lot about making sure to pee after sex. I'm like, if there's one thing that I want people who listen to these Instagram lives to take away, it's that they should always pee right after sex, and then this can help you not get a UTI, and no one wants to be in that position because it's a lot of painful and frequent urination, and you have to go to the doctor to get prescribed some meds to fix it a lot of the time, or sometimes cranberry juice or like some other over-the-counter remedies can be helpful, but a lot of the time you probably need to get some kind of prescription medication. So always pee after sex, no matter your gender. That's an important thing to do, but it is easier for folks who have vaginas or who are assigned female at birth to get a UTI. And that's just because we've got shorter urethras versus our folks who were born with penises or who were born and assigned male at birth. The next tip to remember from last week or a previous week was that you always want to use the front to back rule. So this is basically wiping front to back if you use the bathroom. You never want to wipe back to front. That will help you get bacteria in your urethra area. So when you go to wipe, just make sure to start around your clitoris and around your urethra and go backwards towards your anus or your butthole. Same thing applies, or the same rule or guideline applies to sexual acts. So if you're engaging in sexual activities and you are I'm not finding the words. If you're engaging in sexual activities and you've started in the front, so like maybe someone's using a toy or having insertive sex in the vagina or the front hole or playing with someone's clitoris, things like that. If you started there, you want to kind of keep your activities there and then work your way to anal play or things like butts and butthole stuff. You don't want to start in the back or with anal play, and then work your way to the front. If you do it in that back to front order, you have to like stop and wash your toys and like change condoms and wash like hands and things of that nature. Otherwise, again, you kind of put yourself at risk for getting some kind of bacteria infection. So always, always, always listen to the front to back rule. And same thing applies like if you're a person who might have a bidet or a tushy, for example. Personally, I used one pretty recently, and it was kind of like, oh, like I feel like I can just use this bidet, and I can also just like bend over a little bit and like let it clean me in the front. But that is the opposite of the front to back rule, and will also probably get you into an uncomfortable situation where you get a bacterial infection. So just apply the front to back rule everywhere possible in life is what we'll say on that. But yeah, now into our new material. So once upon a time, in a previous rendition of Whitman-Walker, we had a lesbian health night, and had folks who recently just retired from our organization who ran that lesbian health night, and have kind of run different kind of women's health nights in DC over the years. And so in that space, they used to teach women and trans men and gender expansive folks how to conduct self-exams. And they did this by having two volunteers, one of which would undress from the waist down and like get on a table, and the other one who would kind of conduct the exam so that people who showed up to the event could watch and see how to conduct an exam of the vagina or front hole, and kind of just see what the proper angles and things to look for and things that are normal are, and would demonstrate that to the volunteers or to the people who showed up to the event. So super cool, very, very retro sexual health practices and education tools. But that said, people who attended the event, the lesbian health night or the women's health night, would get to leave that space with a free speculum and a free mirror so that they could go home and do their own self-exams. So cool fun fact. But now I've got some instructions from healthline.com on how to perform your own self-exam at home. So to do it at home, you'll need a mirror, a pillow, a small flashlight, gloves for your hands, and a diagram of the vulva in case you don't know all the things down there by heart. But first you want to wash your hands thoroughly with soap and water, or put on gloves, and remove your clothing from the waist down. After you've done that, you want to prop a pillow up in front of a wall and sit with your back against that pillow, and then bend your knees so that your feet are kind of near your butt or your buttocks, and spread your knees apart to start, and then try to keep your pelvic muscles relaxed, and this will kind of help you to stay comfortable. After that, you want to hold the mirror out in front of your pelvic area. It might be a bit dark down there, so you could use a flashlight if you want to see better. But once you're kind of in the position and have the flashlight spotlight on the area, you can start to perform your self-exam. This is a good time to refer back to the vulva diagram if you did pull that up, but you can kind of start to look around and identify the different areas of the vulva. So look for the clitoris, the urethra, the mons pubis, or the area that the pubic hair comes out of, as well as the labia minora and labia majora. But just getting used to kind of what the different parts of your body looks like, whether it's like right in that moment or when you're sexually aroused, is always a good thing. But in this time where you've got the mirror and got the flashlight going, you definitely want to look around and kind of examine the vulva or the whole area down there for any small cuts, sores, or lumps or bumps, because those will kind of give you a it'll be the key to knowing if there might be a reason that you should go and see a doctor, and if there's something that might be wrong. Next, you want to gently spread the vaginal or front hole lips with one hand, and hold that flashlight or mirror with the other hand. You can also prop the mirror up and shine the light off of it so it's easier to see. Cool hacking tip. And then you want to gently insert one finger into your vagina or your front hole, and then just note that the inside of the vagina or front hole might feel similar to the roof of your mouth. And if you're feeling any sores or growths along the vaginal or front hole wall while you're in there, that's a sign to see a doctor. Finally, if you smell any foul odors, that's also a sign to see a doctor. Or if you see any unusual colors that aren't like opaque, white, clear, that might be a sign to see a doctor as well. You can also look for any swelling, some lumps, or unusual changes. But if everything's checking out, then it's okay to close your knees and end your self-exam. Also, please note that it's important to remember that your vulva can change, or your vagina, your front hole, everything down there can kind of change slightly in appearance throughout the month. If you notice any concerns that your you're worried about, definitely bring them up at your next gynecological appointment. But you can definitely perform your self-exam once a month and just avoid doing it while you're menstruating or on your period, because I don't think it'll be that beneficial. But yeah, you can do it once a month. But those are the main things on how to conduct your self-exam. If you are someone who needs to access HIV or STI testing, definitely call Whitman-Walker Health. We've got a comment pinned in the comment section, but you can call us at 202-797-4439. Again, that's 202-797-4439, and you can schedule an HIV or STI testing appointment with us. And if you're not located in DC, definitely look for your local community health clinic or local Planned Parenthood, and you can see how you can access testing through your Department of Health. Now, again, as people kind of get new or kind of enter the space of taking more ownership of your vaginal health or your frontal health and are getting used to like what you should look for, that could be a sign to go to the doctor. Always be on the lookout for vaginal burning, itching, or pain, green or yellow vaginal discharge, or any change in the color or amount of discharge, thick vaginal or frontal discharge that resembles cottage cheese, as this could be a yeast infection, anything that smells bad, any unexplained bleeding or bleeding between periods. If you're bleeding and you've gone through menopause already, if you're bleeding and you've just had sex, or if you're experiencing painful intercourse or sex, those are all reasons to go to the doctor and just kind of see what's happening. But again, the sooner that you tend to any changes that you notice in your vagina or front hole, the better and more likely you are to respond to any treatment that you're prescribed. But that's kind of all that we have for you today. And if there's any questions in the comments, please definitely post them. And outside of that, I hope you all have learned some new tips, new tricks, what have you in this space. And of course, before we go, we've got to give you a few reminders about COVID-19 and vaccines. So if you've already gotten your vaccine, that's awesome. You've taken a really big step in helping to prevent yourself, your loved ones, and your communities from getting sick. We've gone through lots of waves of lots of variants that have sort of crossed the United States and the world. So if you do want to keep wearing your mask, that's fully understandable. The vaccine isn't 100% effective at preventing new cases of COVID-19, but it does help prevent severe illness, hospitalization, and death as it relates to COVID-19. So, just always talk to people who you're around, ask them if they've been vaccinated, and kind of make your decision about wearing your mask from there, and just keep staying alert. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has COVID-19 vaccine available, and everyone whose ages 12 and up is eligible to get a COVID-19 vaccine. Please reach out to us at 202-207-2480 to make an appointment. And if you're having trouble making an appointment with us, you can always if you're a DC resident, you can always find information about COVID-19 vaccine walk-up locations and eligibility at vaccinate.dc.gov or by calling 1-855-363-0333. You can track the speed of COVID-19 vaccination lines at coronavirus.dc.gov/don't-wait. For Maryland residents, you can visit covidlink.maryland.gov or call 1-855-634-6829. And if you live in Prince George's County, you can visit their vaccination portal. If you live in Montgomery County, you can visit their vaccination portal, or you can call 240-777-0311. And then finally, for Virginia residents, if you want to get your COVID-19 vaccine and you're in Virginia, you can visit vaccinate.virginia.gov or call 1-877-829-4682. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It's very important that you consider getting the vaccine and discuss kind of COVID precautionary measures with those around you. And just be mindful of masks and keep your distance from others, but especially when you don't know if a person's been vaccinated or not. That's all we've got for you today. And remember to follow us on Instagram, Facebook, and Twitter at Whitman-Walker, and check the website www.whitman-walker.org for the most and latest information on our services, and for more COVID-19 resources and general Walker information, you can call 202-797-4439. Again, that number is pinned in the comments. And you can follow some of our Walker family at Real Talk DC _ and at No Filter DC. But cool. Hope you all have a really wonderful day and are enjoying this beautiful weather.